Yesterday night, Brandon Carlo of the Boston Bruins suffered a brutal hit to the head by Tom Wilson. Now, many of you who watched that game know it was a shady hit, and Wilson may be suffering from disciplinary hearings and some suspensions of games. Let's talk about the medical side of things in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. Be sure to like and subscribe if you want to stay up to date. For now, let's go back to Brandon's injury. This is a bit of a close-up shot here. So you'll see here, Brandon is down, ready to pass the puck. This is Wilson coming off, and unfortunately, he is going to hit the side of his head and essentially slam the side of the head into the boards. I mean, for any hockey fans out there, super shady hit, very dangerous, and Wilson is going through hearings to see whether or not he's going to be suspended for this. Let me know what you think about that down below. And this is the lateral view here. Initially, I thought Brandon suffered a cross-check to the actual neck by the stick, but if you look at the way Wilson comes up, it's actually his hands here. He brings them together and essentially he punches the left side of Brandon's head, and it reverberates right into the board. And it brings about a bit of a double hit phenomenon. So what I mean is that hit one is here. So now we have a force vector of brain moving that way, okay? So the brain is moving within the skull. Then the second hit that he sustains is here. So essentially it's going to reverberate that brain fluid so much more. We're always worried about these double hit phenomenons because it essentially just adds that much more vibration to the brain tissue and puts it at risk of higher types of concussion symptoms or brain damage. Now, good thing I wanted to note here is you'll see Carlo is on his knees but talking to the medical staff. You know, if he got hit in the head, was on the ground, and had complete loss of consciousness, he's on a stretcher to the emerge right away. Here, he's at least talking to us, so that's a good sign. Now, as a doctor, if I'm on the rink side here, I'd be going to him testing his neurological function. So looking at pupils, looking to see if he's got any coordination. Can he stand up? Is he in balance? Can he answer questions? Those are super important things to assess. To be honest, when I look at this mechanism of injury, I am definitely concerned about both a neck injury and a head injury. I've done some videos on neck injuries before, so I'm going to link them up here. But essentially, the neck is a very supple area, and the vertebral bodies, so that's parts that make up the bony parts of your spine, can be prone to breaking and can cause acute nerve injuries and even paralysis. So it's always something you want to rule out. But one thing I'm most worried about is a head injury. So the biggest thing is a bleed in the brain. If there's no bleed in the brain, then of course I want to evaluate from a concussion and treat him as such. So when it comes to brain bleeds, this is kind of a cross-section of a brain and what you're seeing when you get a CT scan of your brain. You can have bleeds in different areas. So you can have a bleed in your epidural region, your subdural region, your intracerebral region, and your subarachnoid region. Different ones are due to different reasons, and they have different implications. But at the end of the day, a brain bleed is bad, and you do not want to miss this in an athlete who's had head trauma. So for those of you who've never seen a CT scan of the brain, I have one here that we can look at. So essentially I want to orient you. Your eyeballs are going to be up here. The back of your head, like this, is down here. And as you go down, you'll see this is all brain tissue. You have ventricles here, which essentially are fluid-filled structures. As you continue to go down, you'll actually see these are your eyes right here and the optic nerves that come out of them. Your cerebellar region, which is down here. So that's a quick scan of a CT scan of a brain. So the two main bleeds that I'm worried about in Brandon's case are epidural bleeds and subdural bleeds. These ones are commonly associated with trauma. This one here is a pictograph of an epidural or extradural hemorrhage. Essentially, it means it's above the layer of the dura, which is one of the surrounding layers that surround the brain tissues. Now, epidural bleeds are commonly associated with acute trauma to the side of the head. You'll see it commonly in boxers. You get punched in the side of the head. There's an artery called a middle meningeal artery that runs through in that space. And with this acute trauma, that artery ruptures and causes this type of bleed. It is not uncommon for these patients to actually have the hit, be okay, be a little lucid, but actually a few hours later, drop down and drop dead, essentially. They need to be monitored for quite a few hours to make sure this doesn't develop. On a CT scan, the epidural hematoma actually has this convex shape. So it's pushing out and it's crescented like this. And that's how we identify it. Acute bleeds on CT scans of brains essentially are bright in nature. Now, the second type of bleed that we're really concerned about in players who undergo trauma to the head is called a subdural bleed. And as you can see here, a subdural bleed now is below that level of that dura, which is the covering to the brain. And it's underneath here. Essentially, you have these little bridging veins that go in there. And With acute trauma, these little veins can rupture, and when they rupture, they'll cause filling of the area in this space. Now, traditionally with these, you'll tend to get headaches right away. They'll also have signs of increased intracranial pressure. So what are those signs? Nausea, vomiting, their pupils can start dilating on you, and that's a surgical emergency, as well as they may walk funny, and they've lost kind of all bowel and bladder function. So these are things I'm looking at and I'm assessing in my athletes. And this here is an example of what a subdural would look like on a CT scan. Whereas the epidural one looked like it came out, this one looks like a little crescent shape. And as you can see here, bright as blood, especially in the acute setting. So that's what this would look like. Now, there are a few other types of bleeds, but to be honest, they are very rarely associated with trauma, and more so due to kind of high blood pressure and other type of venous artery malformations in the brain. Now you may ask, what happens when you have a bleed in your brain? Well, this is where neurosurgery comes in. And we get them to do something like this, which is an emergency cradiotomy. Essentially, the brain is a finite space. It is surrounded by skull. So if there is an increase in pressure, there is no way for this pressure to go up. It actually goes down. And brain pressure going down can induce a phenomenon called coning, which is absolutely lethal and will kill within minutes. So in these cases, if someone's got a brain bleed, we're decompressing by doing a craniotomy, taking a piece out of the skull and giving the brain somewhere to expand to. Now, reports say that Brandon was taken to hospital and observed. However, he has been released. I am confident to say that he likely does not have a brain bleed. Unfortunately, I can't say for sure whether or not he's coming out with a concussion. With that type of hit, it'd be hard-pressed for him to walk away without one. Now, if you want to learn more about concussions and kind of the impact on return to play, you can look at this video here. I think he's going to be out for a few more games. The real question is what's going to happen to Wilson and whether or not he's going to be suspended for, these types of shady hits, because they are dangerous for players and will take them out. If you have any questions or comments, leave them down below. If you like this video, please like and subscribe to my channel. For now, that's all.